Hey guys, now we're gonna talk about the anatomy of the knee joint. So, what is basically knee joint? In the knee joint, it's basically a joint, which means articulation. And in the articulation of the knee joint, it's basically between superiorly the lower femur and inferiorly the upper part of tibia. And if you think about the articulations of knee joint, you will get two types of joints. You will have one between the femur and the patella, and one between the femur and the tibia. So one we call it the tibiofemoral. All right, so you have the tibiofemoral joint and you have the patellofemoral joint. So between the patellar surface of femur and the patella, you have the patellofemoral, and between the condyles of femur and tibia, you have the tibiofemoral joint. And of course, condyle means in Latin articulating smooth surface. Now, if you guys look at the patellofemoral, you can see how the articulating surface that is facing the other bone is covered by hyaline cartilage. If you guys see the white color, this is basically the hyaline cartilage, and these are all ligaments that support the knee joint. All right, so the patellofemoral, and you have the tibiofemoral joints. Now, moving on. The first thing you guys need to understand about the knee joint, it's a synovial joint. And a synovial joint means, like we said previously, you have an articulation between bones. So in that case, this bone comes in contact with another bone. And I want you to think about the synovial joint as if those bones are actually trying to squeeze a balloon. They are trying to squeeze a balloon, and that balloon is actually the synovial membrane. But I just want you to know one thing. You guys, and the articulating part that has the hyaline cartilage here, this is not covered by the synovial membrane. It doesn't need to cover it because it's not a bone. So here you have the hyaline cartilage, and then the two bones are coming in contact to each other's, squeezing that synovial membrane, and that synovial membrane is actually filled with synovial fluid, and that whole thing is basically covered by fibrous connective tissue. So fibrous connective tissue covered outside by fibrous connective tissue to support the joint. And once you do that, like I said previously, you have condensations outside to give you the ligaments. You have guys outside, guys in the front, at the back. So this is basically what we mean by the synovial joint. So you have here the green one. This is the hyaline cartilage. And you have the white, and that white is your synovial membrane. And you have the synovial fluid, because the synovial membrane cells has the ability to produce those synovial fluid. And then outside you are covered by fibrous connective tissue, and after the fibrous connective tissue you have the ligament that supports your knee joint. One important thing, guys, before we talk about the structures, remember that the synovial membrane is going to come for to wrap around the bones themselves. It's not going to cover the menisci. Okay, so this white fibrocartilage is not covered by synovial membrane. Synovial membrane comes to the joint itself. So like I said here previously, it's as if the two bones came in contact, but people here, the hyaline cartilage, the menisci, they are not covered by synovial membrane. Remember that. Now coming back, if you guys think about your tibia and fibula, the fibula has very massive condyles, very convex condyles. However, if you think about your tibia, it has very shallow tibial plateau. So in order for the knee joint to have better congruency with the femoral condyles, we have the deepening effect of the menisci. We have two menisci. They are important for transmission of weight, shock absorption, but they are also very important because they deepen the articulating surface of the tibia. They have thick periphery and thinner centers, and that is going to deepen those areas for articulation with the femoral condyle. Now, if you think about the medial meniscus is broader. It's more into C-shaped or similar in shape. However, the lateral meniscus is basically kind of looks like circular. It's not closed off as circle, but it's kind of circular. It's way smaller than the medial meniscus. And these are fibrocartilage. They are not ligaments. They are fibrocartilage. And we consider them as structures supporting knee joint. Okay, so you have the medial meniscus and you have the lateral meniscus. You have the medial meniscus and you have the lateral. And the medial meniscus is basically attached to the anterior cruciate ligament, the ACL, and the medial collateral ligament. So those guys are actually friends. That's why we call them unhappy triad, because most of the injuries to the medial collateral ligament, we're going to talk about it as we proceed, and involves the medial meniscus. And if there is twisting injury with that, that is going also to involve the ACL. So those guys, we call them unhappy triad. If you think about the intracapsular ligament that supports your knee joint, intracapsular, it's inside the knee capsule, but they are not inside the synovial membrane. It's extrasynovial. Okay, so we have ligaments to support the knee joint, supporting them by attaching people between the femur and the tibia. Okay, so you have the anterior cruciate ligament and you have the posterior cruciate ligament. Those guys are intracapsular. Intracapsular also, you have ligaments related to the meniscus, and we're going to say them as we proceed. Now, you have